This is me standing behind my brand new snazzy reception desk in our new studio in Chermside at Pair Exercise Physiology. So just a little bit to get you a general idea of what I get up to when I'm not at work as an exercise physiologist. I work with the Women's Health Collective. So the Women's Health Collective is an interdisciplinary education platform for allied health professionals to work better with one another, to upskill and learn more in continued professional development in the women's health space. But we also have a bit of an advocacy platform for patients as well. So this is me posing in our vulva costume with my sister, who's the designer. So when I'm not at work as an EP, I'm still at work working in the women's health education space. So a really brief overview of what I'm trying to talk about tonight. I'm going to answer the burning question that most people have: what is an exercise physiologist? What on earth is that? And are they going to make me do burpees and star jumps? Promise you I don't. I'm also then going to speak more about using exercise as a form of medicine for endometriosis. I'll briefly talk about pelvic floor health. And then we are going to do a little bit of moving. So I've got my gear on. We're not going to do anything too intense, guys, but if you'd like to join in, we can get up and have a bit of a move around. And then, again, just a little bit more about our studio at Chermside and Pair Exercise Physiology. So what is an exercise physiologist? We're an allied health professional. We go to uni for 4 years. We're registered with Medicare, and most private health companies now provide rebates for seeing an exercise physiologist. We essentially, our mantra is that exercise is medicine. So as well as looking at the musculoskeletal system, similarly to a physiotherapist, we're also conscious of your cardiovascular system, how your heart and lungs are working, your metabolic system, how your body is utilising energy and substrates. We also look at the way that fluid is moving around your body, and we are very good at understanding pain as well. So as well as all the musculoskeletal stuff, there are other aspects of your systems that we are mindful of when we're prescribing our exercise. So, in that idea of exercise being a form of medicine, exercise is not a one-size-fits-all. Just as you have your own individual presentations of endometriosis, your exercise may look different from your sister next to you who also has endometriosis. It's not a one-size-fits-all kind of thing. We're also seeing now in the research that active therapy, that is exercise and things that you are actively doing to your body, works better than passive therapy, where you lay there and someone else does the movement for you. Okay, so that's looking at that pain management side of research, but also looking a lot at improvements in musculoskeletal pain and recovery from injury. So if anyone wants to talk a bit more about that, please do ask me some questions in the end, or come up and talk to me, because it's a fascinating space. Okay, so looking now at using exercise as medicine for endometriosis. So like I said before, it's not a one-size-fits-all, and everyone has their own presentation of the disease. But we have 3 general guidelines that we use when using exercise as medicine. The first one is to be as physically active as often as possible, and we'll talk a bit more about what that really looks like and sounds like. The second is to restore length and strength to the anterior muscles of your body, and that includes the muscles through your pelvis as well. And the last one is to breathe. And are you breathing? And how are you breathing? And how can we get you breathing better? Okay, so to be physically active as often as possible. And we throw things and statements around all the time in health, especially as exercise physiologists who work in the public health space, of 30 minutes of moderate intensity physical activity on most days of the week. Blah, 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 blah. It usually doesn't actually make much sense to patients when they hear that. What is moderate intensity? What kind of exercise? Do I do this, or this? Okay, so when we speak about being physically active as often as possible, we get you to think about it as all of the movement that you are doing in your day. Are you being as active in your movement as possible? Could you break up those long periods of sitting at your computer with a couple of minutes to walk, to the end of your corridor to go to the bathroom rather than the one that's right next to your desk, and things like that? We also look at trying to help improve your overall cardiovascular work that you're doing in your day. So, riding your bike into work in the morning, gold star. How can we get you more active on your morning commute? As well as the structured exercise that you're doing when you go along to your pump class or your spin class or something like that. Okay. We know that as the more active that you can be, the better your anti-inflammatory markers are in your body. We know that endometriosis is an inflammatory condition, so exercise has the ability to increase your anti-inflammatory markers. Exercise also reduces sort of excess estrogen levels, and estrogen also fuels the disease of endometriosis. So again, being able to reduce those levels is really beneficial. And we see that through any of these general physically active movements, cardiovascular work. We also see that physical activity increases the blood flow to your abdomen, and movements using your lower limbs and the musculature in your lower limbs, they work as like an additional pump to help move fluid from your lower limbs back up into your lymph nodes and out of your pelvis. So sometimes other manual therapists use language like you've got congestion in your pelvis. Well, movement will help that, helps get all those fluids moving around. Number 2, restoring length and strength to the anterior muscles of your body. So in endometriosis patients that I've worked with, the most sort of common thing that we have in common is there's weakness and decreased length through the anterior chain of your body. And that's probably got a lot to do with sitting in a fetal position for a really long time if you're in pain. Yeah? But what we also see is that these anterior muscles become really tight, and they're also weak. So you can have a short, tight, and weak muscle. Kind of doesn't always make much sense because you think sort of shorter it'd be stronger. It can still be weak. On the back of your body, which we call the posterior chain, these muscles also become quite weakened because they're being put on stretch and not being used and utilized in the way that your body really wants you to use them. Pain also changes the way that your body and your motor control works, so how your brain is actually activating those muscular groups. And so using exercise, cleverly prescribed exercise, to strengthen what we identify as tight or short or weak, and lengthen what we identify as tight and short, can help with improving pain that you experience. Okay. We also see one muscle that often gets left out of other exercise programs, and that's your pelvic floor. So pelvic floor is a muscle, just like any other muscle in your body. It has fast twitch and slow twitch fibers. It's not as easy to get in touch with because, of course, it's not like your bicep and you can watch it while you're doing your exercise. It's got a lot more to do with cueing, imagery, and understanding of how that muscle works. But when your pelvic floor muscles become chronically tight, that can lead to some of those other side effects of incontinence, constipation, lower back and hip pain, niggly, achy pain that doesn't really have any rhyme or reason. And we see that exercise helps in reducing those pain sensations. Angie's going to talk a lot more about pain and chronic pain and how it changes your brain. So I don't want to double up on us too much, but she'll be covering all of that later. So our last general advice for exercise as medicine in endometriosis is, are you breathing? Can you breathe? Your pelvic floor and your diaphragm, they work together. Your entire core, in fact, works together. So a lot of people in the fitness industry have kind of taken over the word core and put the wrong kind of understanding on it for the general population. So your core is not your abs. Core exercise is not your abs. Think of a core of an apple or the core of a pear. If you cored an apple, it's literally the very, very inner workings of that fruit. It's the same as in us. So your core, your true core, is your diaphragm on the top, your deep abdomen through the front, pelvic floor on the bottom, and deep lower back muscles through the back. And those four muscles need to work together. There needs to be some synergy between them for them to be able to create that core support. And we see one of those muscles maybe not working as optimally as it should be, so your pelvic floor is very tight, then the other muscles don't get to work as well in sync. And that can then change your breathing, so your diaphragm on the top. This kind of makes any sense. So as you inhale breath, diaphragm drops down, pelvic floor, gently relax. As you exhale breath, diaphragm draws up, pelvic floor draws up in response. So we see a lot of people who end up not breathing through their exercises, and then they're not getting all of the brilliant benefits that come with being physically active and exercising. So can you breathe when you do your exercises? Are you making lots of grunting noises and noises? Probably means that you haven't quite got that core strategy 100% correct. So core breath exercises, and also modalities like meditation, restorative yoga, where there's a lot of focus on that sort of down training, relaxing, letting go and breathing, can be absolutely fantastic for pain management patients, including endometriosis. So not all movement is created equal. Like I said, it's not a one-size-fits-all. There are some general exercises that we would advise to avoid if you have endometriosis, if you have high pain, or if you've recently had surgery like a laparoscopy or a hysterectomy or anything in your pelvis. So generally, activity where there's a strong pelvic floor component, so it's creating a bit of stability in your pelvis and there's a lot of impact. Running, if you love it, I'm never going to tell anyone to stop doing the exercise that they love. But maybe we can have a look at ways to support your body as well as running. Pilates, and I put lots and lots of asterisks next to this because we love Pilates, but we also have a love-hate relationship with Pilates. The best way that I can explain this is if you only ate a diet of vitamins and supplements, on paper, brilliant. You're ticking all the boxes. You should have everything that your body needs. In reality, you'd be pretty unwell. Only using Pilates as an exercise modality is kind of like having a diet made up only of vitamins and supplements if you're not correctly performing those exercises. So we like to use Pilates in with a big healthy food plate of movement, which is what we call functional movement. So just general everyday movement, plus some vitamins and supplements that your body needs. That kind of makes sense. Boot camp exercises and core exercises in that traditional sense of going to the gym, going to the PT and doing lots of abdominal work can sometimes not be the best movement that your body needs right now. Okay, so briefly looking at the pelvic floor, and I'm guessing a few people may have seen this imagery before in handouts and things that they've received. So your pelvic floor attaches from your pubic bone through to your coccyx. Unlike that imagery, it's not like a big flat hammock, it's more like a wicker basket that sits underneath your pelvis. When we see that when your brain receives a signal of pain, it responds. So it responds to that signal by creating the pain, by contracting your muscles, by elevating your heart rate and increasing your blood pressure. And if that's chronically happening, then we see that chronic tightening of musculature around the pelvis. It's a protecting thing. When we see those chronically tight muscles, like I said, we see pain and dysfunction. So some of those things I mentioned earlier. Awesome. So when I was talking about that core muscles in the very center of your body, this is what they look like. So we've got our diaphragm that sits on the top, pelvic floor that sits on the bottom, transverse abdominis, or TA as it's often shortened to. Any Pilates people in the room, they talk about your T zone, yeah, transverse abdominis. And multifidus, which is the musculature that sits up your lower back. We're going to have a think about this core musculature and the need for it to work together as we go through a couple of exercises in the next part of my presentation. So it's probably a good thing that beautiful Angie is here tonight as well, because Angie's a physiotherapist, and often our modalities get mixed up or are used interchangeably, but we work very differently in practice. And so We always advocate for patients who are coming to see us to participate in a supervised exercise program and to have me create one for them to do in their own time. That before they start a pelvic floor muscle training program, it's important to identify where they are, how you're using them, and are you actually activating them in the correct way. So we would refer to a women's health physiotherapist so that they can work on that local activation. So just here. Then when you come and see us, we look at taking this and translating it into the whole body picture. How are you standing, moving, walking, exercising, breathing? And we can then also look at any compensation patterns that your body has started to take on. If you've had chronic pain and you're sort of constantly in this position, how does that then change some of your other movements? So kind of try to unscramble it all. But we always do advocate that you start locally, women's health physio, then moving into global movement, exercise physiologist. Hopefully that's, on par with it. Brilliant. Okay, so we are going to have a go at a pelvic floor exercise right now. You can stay seated for this exercise. If anyone's really keen, you can get down on hands and knees. Yeah, 4-point kneeling. I wore the right clothing, but obviously whatever you're most comfortable with. Okay? When, as I said, you don't actually get much contact with your pelvic floor. It's mainly about imagery and cueing. And so the imagery that we're going to use tonight is the idea of a flower blossoming out of your vagina. Cool? We've gotten over the giggle of the word vagina? Great. So making sure that our diaphragm is working in time with your pelvic floor, I want you to start. Guys, you can join in with this too. Your imagery is obviously not coming out of your vagina, but out of the tip of the penis. Okay? So we're going to think of starting with that gentle inhale breath. Everything is relaxed. Gentle exhale breath. Your flower petals are closing and drawing up into the bud. As you inhale breath again, you're going to imagine that flower gently blossoming, petals opening. As we exhale breath, closing the petals, gently drawing back up into the bud. Brilliant. I'm just going to move my hand and you guys can breathe in your own time. So this is the kind of imagery that we would use in adjunct to larger global movements. So we may start with just sitting until we find that you feel comfortable with that movement, and then we'll progress you to like a squatting motion. So we inhale, and then exhale, and come back up. That gives you an idea of the kind of things to expect from seeing an exercise physiologist. Okay. What we want to avoid when going through more global exercises, so say we've now progressed your flower blooming and blossoming into a squatting pattern, is drawing your belly button in towards your spine and gripping, breath holding, making that noise. Means that you're not breathing and you're not using your core synergy in its optimal function. So some of the cues that we see incorrectly used, so maybe your motor control for how you're activating that muscle group is not quite right, is the cue belly button to spine. So again, any Pilates people in the room, hate that cue, worst cue ever. It's not your belly button towards your spine. Because if you draw your belly button towards your spine, we're actually bearing down on your pelvic floor. So your core synergy is not working together. If you think about a balloon that's inflated, and if I pinched it in the middle, you'd see the balloon at the top and balloon at the bottom, which is not ideal. We don't want that downward force and pressures. What we want to do is gather the balloon from the bottom and then squeeze in the middle, and you just see the big dome at the top, which is your diaphragm. Does that make sense, that imagery to everyone? Cool. Another great pelvic floor exercise, again, don't worry if you don't want to get down onto the ground, but cats and cows exercises. This is on hands and knees, breathing in time with a larger, more global movement of your body. So, can you see me on the floor? We would start with a inhale breath. We would tuck your chin towards your chest and tuck your imaginary tail between your legs. And then you would inhale breath and draw back open, like a happy cow. Angry cat, draw your chin towards your chest, exhale breath. And then inhale breath, coming back open. So using exercise as medicine, like I said, our lovely new studio has just opened at Chermside. We work not just with endometriosis patients, but with women during their pregnancy, after delivery. We work in PCOS, prolapse, incontinence, and general pain management. So we work across that large umbrella of women's health. This is my little team, so we're all exercise physiologists. We each have different specialties, so Nicole has her Pilates specialty, and Naomi actually has her boxing, so she does some boxing with clients. Okay. Naomi has endometriosis herself, so she has a great understanding of the condition and how she has used exercise as a form of medicine for her and as part of her ongoing pain management. She shared her story on our Facebook page. So if anyone's interested in learning a little bit more about Naomi and her exercise as medicine experience, you can read that one. That's our space. That's also our space. That's also our space. And then we were going to offer, we would like to offer a sort of a special QENDO deal. So we know that it can be intimidating to come and see a clinician like an exercise physiologist. As I said, I promise I won't make anyone do burpees and star jumps. It's exercise as medicine, okay? But the idea of being able to bring someone else along always makes that experience a little bit better. So if anyone is interested in seeing an exercise physiologist, we have these deals available to QENDO. Brilliant. Thanks once again.